Magic 89.9.
Can't hear myself. Hi, it's 6:13. Welcome to Healthline.
And
Wait,
yes.
wait. I am not. See, you guys.
Why can't you hear anything from here? What's wrong?
I know. Chief, I can't hear. But yeah, because the reason why Jada brings her own headset.
so
I kind of panicked because I was going to start talking. I'm like, oh,
Maybe
crap.
you just need to put up the volume. Yeah?
Nope.
Nope. That's
Nope.
not the one.
Wait,
Okay. Yeah, I can't hear anything either.
Say hi first.
Okay, we're saying hi and good evening to everybody who's, you know what? You're supposed to press the red thing, Tina. Yeah, there.
one?
Yeah, there. Yeah.
Here.
Okay.
Still can't hear myself. Jada!
I don't know what's wrong.
Okay. Here, let me use that.
Yeah, use this one.
Okay, let's see. Hi, everyone. Okay, now I can hear myself.
Good girl.
The silence is deafening. Okay. Here we go. Okay. So the traffic is horrendous. I think you should just stick around for another 20 minutes.
No,
maybe.
15 minutes.
15 minutes, you know who's coming in 15 minutes?
Who?
Neo Colors! They're going to be here to promote their new single. Doc Ryland is just stuck in horrendous traffic. So I told him, hey, I'm here, partner. Relax.
Yes.
You know, relax.
Direct Alvin, don't show me. Oh my God, he's showing me.
Direct, hi, Direct. Thank you.
Direct, you're showing me on TV and I'm like,
Yeah. Ito na, sumbo kita kay Chief. Chief,
Yeah.
I don't know what Jada did to the headset.
But it won't.
I can't hear anything.
But what are you going to be talking about for this episode of Healthline?
Oh, well.
Tina, it's very interesting. I already talked to your guest. I have some questions.
Right? So we're doing men's health tonight. Because last week we did female reproductive system.
I love it.
We're going to talk balls.
We're going to talk balls tonight.
I believe I just said that.
Yes.
But hey,
all
I mean,
shapes, sizes, and colors.
exactly. And you know, we
I
have.
want to know, it's like a one size fits all, or
That's why you should stick around. We got a urologist on the show to talk about, you know, men's, common questions, I guess.
I wonder.
Do you have anything?
I wonder if Doc Ryland is still willing to come in after all the things that I said. I'm like, yeah, I don't have my headset on, so I really don't know how that one sounds on air. But yeah, hey, they can call you up 8631-0899.
Yeah, if you guys got problems,
Questions about the people you know. Tago natin sa pangalang, you know, things like that. Playback.tv.
Or asking for a friend.
Yes, asking for a friend.
Yeah, so we're going to talk about your urinary and reproductive health. Nothing's off the table tonight because we got a urologist who'll be answering all your questions.
Yes.
Doc Ed Vizmonte is with us tonight. And of course, the iconic Neo Colors dropping by to promote their latest album. Oh my God, look what Doc just pulled out.
Balls? Model balls. Or what balls are supposed to look like.
So that they could understand.
I feel like I'm in anatomy class.
Okay. There are going to be visuals, so you might want to download Playback if you haven't yet. Playback.tv/magic899.
Oh my gosh, welcome to Healthline, girl. Thank you so much for keeping me company. Right now, it's DJ Snake.
Magic 89.9.
Ryland Flores, orthopedic surgeon, DNA profiler. I'm just making him benta.
I know. Hello, friend ka talaga. Hello, everyone. Welcome to Healthline. It's with Tina Ryan and Doc Ryland. How are you?
Okay ka na.
I'm good. Despite the traffic, I'm good.
You know what I love? I love when he texts me like he's gonna be late. You know, I appreciate it. I appreciate it because it makes me feel like you really love being here on Healthline.
Of course, I do love being here.
And I love having you here
here.
Okay, anyway, so Doc Ryland and I will be keeping you all company until 8 o'clock. And like we said, we're going to talk about men's health.
Yeah.
You know, because last week now you brought a gynecologist.
Women's health. So
Women's health.
there were some calls from guys. Like, what about us?
Yeah, I know.
So okay,
I know.
we're bringing in for men's health this time.
And then I see like our guest, he arrived early. I appreciate that as well, Doc. He's got he busted out something from his bag, but may baon na.
I know. Visual aids.
Yeah.
So they really have to watch this.
Yes. So if you haven't downloaded Playback, I highly suggest.
Download right now.
And speaking of playback, hello to everyone on playback. Christian and Tito Lad and Kim, who's in Melbourne. Hi. Again, spread the word. It is Healthline. We do this on Wednesday nights. If there's anything you guys want to talk about,
Exactly.
please send us a message on our socials. Diba?
Yeah, our
So-
socials, or they can actually give us a call here or message us.
Oo. What else? Who else have we not brought here? Diba?
Well,
Dami pa, no?
there's still a lot out there.
There's a lot.
There's still a lot out there.
Yeah, and we're still waiting for iconic
course, the
band Neo
iconic,
Colors.
yes.
Although
We're waiting for
parang
them.
feeling ko they might not even be able to make it. I've never seen Traffic. I mean, not that I've never seen it, but it's so bad.
Well, the thing is-
midweek pa lang.
With the rains, and people are asking if there's a typhoon or not. I know there's a typhoon coming, but it's still, I think, for next week. So this is just like the regular, how do you call it, low pressure areas.
Yeah, but we're supposed to expect like 19 typhoons from
We
now
always
until
do.
December, diba?
We always do.
So, this is Healthline. It is 6:34. Let's play something from Kid Leroy. This one's called How Does It Feel on today's best music.
Magic 89.9.
Ah,
Magic 89.9.
just kidding. I'm everywhere.
I know, right?
Hold on.
They're still listening
there's your
to
mic. There's your
Healthline,
mic.
by
Hi.
the way.
Yeah, 6:39. I have a very special person to say belated happy birthday to, because our barangay loves him, family loves him. It's my favorite.
So happy birthday.
Doc Alex Santa Maria, actually, Counselor Doc Alex Santa Maria. Hi,
Happy
belated happy birthday,
birthday.
Doc, and thank you for all that you do for the family and our little community. And yeah, he visited Dad too when Dad was sick. So we love you, Doc Alex.
I beg to disagree on the little community. That isn't little.
Oh, no, our barangay is one of the smallest actually in Mandaluyong.
It doesn't feel like it's the smallest.
Yeah, but we're like one. When we say we're one, we get together. But Doc Alex, belated happy birthday, and please message my mom because she refuses to get her shot for her eye. Right? Remind her that she needs that. So you were saying that a few days ago it was
August 1.
August 1st was White Cane.
White Cane Safety Awareness Day.
Wow. Okay, and you went on Facebook Live to talk about it.
Last weekend, yep.
White cane for me is like, ang una ko naisip, suka.
That's cane vinegar.
White cane. Okay, so tell us about white cane.
Now, white cane, well, we all know what cane is used for. It used to be a weapon. It used to be a symbol of
My mom
authority.
used to beat me with it.
That's why it's a symbol of authority because we got beaten by that.
Yeah, okay.
And royalty and all of these things. But nowadays, we actually use the cane for those impaired.
Yeah.
So I mean, if you have trauma, you've had an accident, you underwent surgery, you might need a cane for ambulation. But you also would need a cane if you have visual impairment.
Ay, pag emotional impairment.
Pinangahataw yung cane eh.
Maybe we should have a psychologist over. Let's talk
Exactly.
about emotional trauma. Diba?
So the reason why it's called white cane is because it's the color of the cane. It's white. One, the cane is for the visually impaired. They can actually feel their surroundings via the cane. But for those seeing the person who has the cane, if they see it's a white cane, you'd know right away that that person is visually impaired.
Ganon.
So they're either blind or really couldn't see.
Yeah.
So you know what to do.
I will probably end up blinging my cane out. Just,
Panghataw
I'm gonna
nga eh.
I'm gonna make it like a disco cane.
Can do.
Designer Dad. Same, hinampas ako ng lolo ko ng cane.
We can all, I think we can say that we can all relate.
Namutimat ako sa sakit eh. White cane.
Oh, that's called white cane love.
Oh my God, here we go. Designer Dad, I think you're going to enjoy tonight's subject. Urology 101.
Yeah, you can always ask for a friend.
Maybe I can have like a little demo of what Doc Ed brought for me
He
tonight.
brought along
Not that
visual aids.
Yeah.
So,
Oh
so
my
you
God,
have to.
the other ball just
So for those of you who don't have playback, You have to download playback.
Wait,
right now.
what exactly am I holding? I feel like I just want to. I want to thank my fans. Oh my God. What is this I'm holding?
I'd reserve that for our guest this evening.
Yeah. So I'm just showing you guys what I don't know what it is. It's probably like obviously like a male part inside. Okay, we'll talk about it. But yeah, we have Dr. Ed Vizmonte joining us a little bit to talk about men's health. So please stick around. However, I do have the latest from Lola Amor. You got to check this out.
Yes.
Got to check this out. This one's called Dance With My Mistakes.
Good evening.
On today's Best Music.
Magic 89.9.
Ah!
Magic 89.9.
Fine. He's like, yeah.
No, I just
love apart from the
songs.
fact that he's like a doctor, DNA profiler, he is a huge K-pop diba?
Yep.
Yeah, so
Not
we want
me.
to
I just have a daughter who loves K-pop.
belated happy birthday, Bella. And I know she's leaving for Paris. So I don't even know what to say. I mean, have fun. I mean, Paris is beautiful. You know, I mean, I made a bunch of friends when I went there, way younger. Students from Brazil who I ended up seeing in Dublin. Funny enough.
Wow.
But yeah, we were so broke. We didn't want to go inside the Louvre. Mahal.
So what did you do?
We ended up going, but you know, I'm not like my artsy kind of girl.
Okay.
You know, everybody's like dying to see the Mona Lisa, and then
It's just a small painting.
it's small.
I mean-
I couldn't believe how small. it was.
I mean, it's like seeing all of these visuals all around you,
Right?
and then you try to look for it, and it goes, "It's over there." I go,
Yeah,
"Where?
I-
Oh, okay."
'cause I was
Oh, so
expecting-
it's that small.
I was expecting something magnificent, you know, like at least like maybe ano man lang,
But
malaki-laki.
at least
diba?
when you do see it, it's kind of mesmerizing.
But anyway,
really.
going back to the K-pop Demon Hunters.
K-pop Demon
we
Hunters.
have a trivia, okay, and this is coming from my orthopedic surgeon partner.
No, but I read somewhere that they're actually nominating Golden for the Oscars.
Wow.
And if they do win, it'll be the second song from an animated movie, because the first one was 4 years ago by
Which movie?
Lin-Manuel Miranda.
Oh, I didn't see it.
Okay.
Okay, but I think this weekend I'm gonna find time to watch K-pop.
Please.
Demon
You'd
Hunters.
love the
already wrote
entire
the sound.
soundtrack.
Yeah. I just don't
Love Dance
understand.
and Soda Pop.
Still coming up on the show. Why don't you say hi already, Doc Ed, since you're here?
Hi, good evening to everyone.
He's coming up. We're going to talk about men's health, you guys.
Men's health this time around.
You know, P talk. What else is ano ba ba?
E-talk, urinary tract
It's
infection.
men this time. It's men's time.
The men's turn this time. Designer Dad, you have your questions ready because we are very excited. Okay, I have room for one more song before I do top of the hour. Here's something from Sleepy Hollow on today's Best Music.
Magic 89.9.
Magic 89.9.
Yeah, I forgot the time. It disappeared on me too quick. 7-Eleven. Oh, 7-Eleven.
Yep.
I wonder what happened to my favorite dish there. You know, Chef Claude Tayag had a
That was
collab
before.
with 7-Eleven. The sinigang sa kamyas is just so yummy.
But it was just like for a short while, and then it was gone.
no, it was like pre-pandemic meron pa. And then they brought it back and now they pulled it out. Come on. What's wrong with you guys? Okay, so hi. This is Healthline. On Wednesdays, we talk about your health or whatever's bothering you physically
Exactly.
in your body. I have my awesome co-host with me. His name is Dr. Rylan Flores.
Hi there, everyone. And
Orthopedic surgeon lang naman.
we'll be talking about not mga buto, but other things for now. We'll be talking about men's health, and we have a very
Starts with
good
the
guest.
beat.
Yes. Bisayan.
I'm going to say it off air. I'm going to say it off air.
It's the same spelling.
with a different accent.
Oh, anyway, again, hello mga ka-Healthline. So we're going to talk about keeping things flowing smoothly.
Yes.
If you know what I mean. I don't. What's supposed to be flowing smoothly?
That's
but I don't.
actually that's well, Yeah, we'll be talking a whole lot
Why am I
about that
laughing
tonight.
already? Oh,
Urination. Urination.
It's urine. Why? What were you thinking about?
keeping it straight.
Oh my God.
Here we go, designer dad.
But we haven't even started the discussion yet.
Welcome to the show, Dr. Ed Vizmonte, urologist.
Good
Hi,
evening. It's a
Doc.
pleasure being here.
Okay, Doc, first and foremost, I heard you're super busy, that my partner had to, like, I don't know, adjust your schedule. But welcome to the magic booth. Okay.
Yes.
Let's do this.
Go ahead. I know you're itching with a whole list of questions.
That didn't sound right.
What? See, we haven't even started discussing anything yet.
Okay, so coming from a woman ba or man muna? The question.
Coming from you, I guess.
How about
We're just trying to make sure that we don't get
Ito na
beeped
lang.
a lot here.
Doc, ito na lang, Doc. For those of you just tuned in, we have a urologist here, Doc Ed Vizmonte, joining us on Healthline. When should we actually start seeing a urologist? And
Okay.
is it just for like older men and women?
Yes, yes.
Okay.
First of all, they should know what a urologist is.
Tell me, Doc.
Yes. Urologist is the spelling is URO, not neuro. It's urologist. URO. It's like urine.
There you go.
So we're experts in all where the urine flows.
So that's the best
incontinence is something that you
Yes, it's included. So men and women, we specialize.
So it's
everything
both
is a-
both men and women.
Men and
diba?
women, and then included is for the male reproductive system.
Okay. Pero your patients are mostly men?
Yes,
Tama ba,
men,
Doc?
but 30% are women.
Okay.
Because it's urine flow. I mean,
Yes.
regardless if you're a man or a woman, you
it's-
still need to urinate, right?
Yeah. Doc, ito talaga seryoso. Incontinence, is that genetics?
With regards to incontinence, there's a lot of reasons why patients have incontinence. No, there's stress incontinence.
Oh,
or
yeah, I've
maybe
had
maybe there's a blockage of urine. There's overflow incontinence.
Oh, no.
Overflow incontinence.
No, wait, okay. Iba yung incontinence sa, what is it?
Incontinence, you can't control urination.
Yung pag kiniliti ka, hindi incontinence yun. Yung madali ka lang mawiwi, diba?
It's still incontinence.
Okay, so, yeah. Because, like, for some reason, the women in our family, like, you make us laugh and we're, like, holding on to our dear
Yes.
Because
crotch.
you
Because
need
we're going to
to-
pee. 'Cause,
Yes,
yeah.
yes.
So,
That's what we call stress incontinence.
Oh, that's stress already.
Yes.
I
But
was
it's a good kind of stress.
No.
I was thinking when you say stress incontinence, it involves,
Like-
stress is like thinking too much.
or, like,
So-
like traumatic.
Yeah, something like that.
Yeah.
Something
No. Stress is like a
Kilig daw.
pressure. No, it's like a pressure. No, so like when you're laughing, it produces pressure. So because the urinary bladder, the urine is stored in the urinary bladder. It's just
Okay.
below the navel. It's like a balloon.
Okay.
Now and then below the balloon, there's a sphincter in women. Now sometimes it weakens. No, so if it's weak. Once you laugh or you cough, you urinate.
Oh my gosh.
so that's why.
So it's not naman abnormal.
It's a little, but we could fix that. No, you just do
Kegels.
exercise.
Alam mo Kegels.
Kegels. No, because
Yeah.
my gynecologist told me in San Diego that I should. I mean, who has
Yes.
time for Kegels?
No, you
Well,
know
it's
that you
just
should
minutes,
do
right?
Kegels 100 times a day.
100
While washing
times
clothes,
a
talking right
day.
now.
That's the recommended. That's the recommended.
100.
Yeah.
Doc Ed,
You know
for what it's worth, can you explain what
Kegels,
Kegels
yeah.
exercises are?
Kegels, it's
We always hear it kasi.
Yeah, it's KEGEL apostrophe S.
Okay.
no?
Okay, Kegels.
Kegels exercises. It's actually letting the muscles of the sphincter contract. The sphincter, it's like a faucet.
Pambabae lang yan, Doc.
It's
diba?
it's both for men and women.
Oh, so both.
Both for men and women.
Okay.
Okay.
No? So the nerve supply of the sphincter, it's a muscle that constricts below the balloon, the urinary bladder.
Okay.
Now as we age, sometimes it weakens. So to strengthen that, you have to contract it always. You have to exercise it. Now, the principle here is the nerve supply going to the sphincter muscle and the nerve supply going to the vaginal muscles and rectal muscles are branching. So once you contract your vaginal area or your rectal area, it also contracts the sphincter muscles.
Okay.
So you strengthen the sphincter muscles.
Okay.
So in doing so, you can't concentrate just on the sphincter. So everything else around it is what you do with Kegels exercises.
that's
I get
it.
it. But both men and women, ha? Akala
Yeah,
ko all the
both.
while women lang.
Yeah, me too. Akala ko women lang
But
din.
with regards to women, there's what we call a long twitch and a fast twitch.
Wow. Okay.
Yeah.
Wait. Can you describe the long? No, I'm trying to understand it.
yeah.
The long twitch and the short twitch.
Yeah.
Or the fast twitch.
When you can't control the urination, what we call stress incontinence, like when you laugh or you cough, that's what we call stress incontinence.
Okay.
So you have to practice the Kegels exercise in fast twitch.
Fast
So
twitch.
fast twitch is when what you do is 1, 2, 3, 4, 5 like that.
And then there's slow is
Slow is when you
May
can
rhythm.
control your urination all throughout. So
there's a difference.
when you contract your sphincter muscles, you do Kegels exercise. You have to count 1, 2, 3, 4, 5, release. 1, 2, 3, 4, 5, release.
So it's like a beat and a song.
I know I was gonna say.
Yeah.
Are you parang nung exercise sa high school? I must.
Yes.
I must increase my bust.
And it's very important that you do it 100 times a day.
100 times a
So,
day.
so 30 in the morning, 30 in the afternoon, and 40 in the evening.
What are the benefits of Kegels for both men and women then?
Yeah, you strengthen the sphincter muscles in
Okay.
controlling your urine.
Okay.
So that is the most important thing there.
Yes.
Now, how?
Actually, with regards to Kegels, it actually in men, it strengthens. It cures. It's one of the exercises to control your ejaculation. Because some patients have premature ejaculation, right?
Oh,
Y- y-
okay.
you're-
Also, wow. Okay,
You're
so
diagnosed to have premature ejaculation if you ejaculate during sexual activity in less than 1 minute. So,
Hold it.
Minute,
In
minute.
less than 1 minute.
Oh yeah.
Si Elliot. No,
Basically the new definition is you can't control it.
Okay, you
And then
can't control
yes, and
it.
Kegels exercise is one of the exercises. So that
So
you could
100 times a
control
day,
it.
huh?
may kanta
Yes,
si Missy
100
Elliot
times a
dyan
day.
ito. Hold on ito.
Okay.
Minute Man. Let's play it in the background. Okay. So, like a urologist, doc, is that something also yung sperm count? Do you also deal with
Yeah,
that?
for the infertility.
Ah.
Okay. It's very important, no, in couples. If within 1 year, you can't produce, you have to really, the man should really
Get
see
checked.
see a urologist, and the wife should see a gynecologist.
That's what she
Remember,
said, 6 months, diba?
that was
Last week,
our
yeah.
guest last time, Dr. Mitch
yes.
Dado mentioned
Yeah.
that yes, I will see the girl, but the boy also has to be seen by a urologist.
Yeah.
That's why we have a urologist this week.
If you guys have any questions for Doc Ed Vizmonte, he is a urologist here on Healthline, 863-10899. The Viber
Yes,
line.
our Viber line is 0945-971-4011.
Doc, I got to take a super short break. How about, again, it's 863-10899. Anything men's health related or like, the
Urination.
urination.
Or
what else?
stones, urinary stones.
Ayan, okay.
UTI.
Guys get UTI too?
Yes.
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 Oh, okay. Okay.
Everything about urine.
Okay, here we go. Doc. This is
Go with
Healthline.
the flow.
Ready to take flight with a much
Magic 89.9.
7:30 on Healthline. You got Tina Ryan and Doc Rylan Flores
Hello.
with Doc Ed, a urologist. before we asked our next question, I'm inviting everyone tonight. So, inviting everyone tonight. If you happen to be bored or no plans at all, I'll be hosting and singing the open mic night at La Noire. La Noire. Oh, French. But La Noire. Oh, you practice getting in French while you're off to Paris. La Noire at the New World Hotel tonight with Dior Bronya and the Soul Review Band and Just Friends Band. Oh, I'm so spoiled tonight. 2 doctors, 2 bands.
Great.
Only cocktail, only wine, 2+1 Corona. Hey, and me as your host.
We're looking at it.
Okay.
We might be there later.
No. Speaking of cocktail, Doc Ed, this is. Oh, I know. I mean, I always tell people I have a bladder the size of a peanut, whatever. Okay. So why is it that when I just drink one, I'm not big. I'm not a big drinker. I don't understand why some people I know or some friends of mine can drink 7 beers and not get up. I drink one and I'm up all night peeing like crazy. Why? Is that normal?
Different people have different, some urinate right away, diaries right away, but some control it. But it's very important to know that once you're drinking, you have to remember to pee right away, because during when you drink alcohol like beer and wine, it's a diuretic. It makes you really produce a lot of urine, and then when you hold your urine, you are more prone to urinary tract infection.
Oh, UTI is not a friend.
Yes. So it's very important when you drink alcohol, you'll remember to go to the comfort room right away when you feel like urinating.
Okay. Well,
So
I
never-
can't.
just urinate.
Never hold your urine.
Never hold it. Just urinate.
during
But
session.
it just depends on how often you'd go. It depends on your body's reaction. As we were told that it's a diuretic.
Yes.
Yeah, I got girlfriends. They have like super bladders, man. I mean,
Yes.
they're drinking like 5 bottles of beer, and I'm like,
Maybe they are they have a stronger they could control their urination better.
My
But it's
gosh.
never.
But
it's not
it's not-
advisable.
it's not
advisable
ideal, right?
To control your urination.
Really?
So it's really better to just
You
just go pee.
urinate always during.
So try to be a little near the comfort room.
okay. What drinks should women avoid if they're dealing with bladder sensitivity?
Bladder sensitivity, you really have to avoid the alcohol when you have bladder sensitivity.
Or anything diuretic, you mean?
Yeah.
Wala nang liquid talaga.
Because in women, there is what we call overactive bladder.
Also, mine's that, probably.
Yes.
And is that
overactive-
normal?
Yeah, we could treat it actually.
Kegels.
Because with regards to overactive bladder, considering that you have no UTI or other problems, if you urinate frequently and you can't hold it, or you have urge incontinence, you can't control your urination, maybe you have overactive bladder. Because in overactive bladder, your urinary bladder, the balloon just below your navel, should be filled up with urine and expand. Now, with regards to overactive bladder, it's not yet filled up. It contracts right away. It's not yet filled up, and it contracts right
It's
away.
like it hasn't reached the maximum capacity yet.
Yes.
But you have the urge.
But you have
Yeah,
the
you
urge
have
right
the
away.
urge.
Because
It could be the overactive bladder. So we have to talk to the patient and have some history, etc. And we could give medications for that.
not just necessarily it's just not just a psychological component, but it's truly pathology of,
of
the
the
bladder.
urinary bladder.
Oh, okay.
Doc, is it true that childbirth weakens bladder control, or can it be fixed?
Yes,
Oh,
yes.
okay.
If you have a lot of births already, it could weaken your control in urination.
That's regardless if it's normal birth or C-section.
Yes.
Oh, okay.
Asking for a friend. Can tight jeans... I'm really asking for a friend.
Okay.
Can tight jeans, thongs, or certain soaps cause irritation down there?
Yes. With regards to women, it's very important that you take care of your down under, or in the right way. When you wash your rectal area during defecation, the fecal material should not reach the vaginal area. Number 1.
Okay.
And then number 2, when especially when you are already aging women, the soap that you should use should be mild.
Okay.
No, like baby soap, or I can't promote the product. And then you should just wash it once a day. No, with soap.
Wash it once a day.
Yeah.
Okay.
And then in between, you should just wash it with water. No.
Oh, so the soap is just once a day, but the washing and the rest of the day is just water.
Just plain water. And then never use vaginal wash.
That's
Because
what your friend said.
Exactly.
Douching is bad, you guys.
Yes, because it destroys the natural flora
See.
of the vaginal area.
2 doctors have been saying that already.
Yes.
Sigus, Doc. Sigus. How about balisaw-saw, Doc?
Balisaw-saw, it's more of like, what do you mean by balisaw-saw?
Yung pag kunyari naupo ka sa mainit na like, di ba ganun yung Doc? Yung kunyari mainit, naarawan yung chair and then you sit on it.
I remember. Balisaw-saw is like you frequently urinate, no? Right?
Yeah.
Oh, okay.
Yeah. Now, there are actually 2 categories of balisaw-saw. Maybe you have balisaw-saw because you have urinary tract infection.
Yeah.
So we have to examine your urine. We should have urinalysis.
It's not just the frequency of voiding, but you sometimes might have pain or difficulty and all of these things.
There you go. The next question is, if it doesn't hurt, it's probably nothing. True or false?
If it doesn't hurt, but you have balisaw-saw, it might be what we were talking about a while ago. It's overactive bladder.
Okay. I mean, like, if you have an overactive bladder, will there be like issues in the future if you don't treat it?
Well, definitely, it affects your quality of life. You have overactive bladder because you urinate frequently. Number 1, and sometimes you get wet in your pants, and you have to use diapers.
Oh my gosh.
So we have to address that.
Who has a funny pee story? Doc, do you have a funny pee story? Because I have a few.
Go ahead.
And I'm not sharing.
Okay.
If you have a funny pee story, please give us a call. I want to give you a prize. Okay,
No, but there are times that because of conditions that they really cannot, go to the bathroom and pee, that they literally pee in themselves. I know one because some F1 drivers do that during the race.
Oh my gosh, yeah.
And they say that's the worst thing that can happen, but they can't avoid it if they really need to pee. They're in the middle of a race.
But the good news is we could treat it, actually. We could treat it.
Doc, does frequent urination mean I have diabetes or kidney issues?
With regards to frequency, meaning frequent urination, there are a lot of categories. You could have frequency, maybe you have diabetes. With regards to diabetes, you have frequency because the nerve supply going to your bladder, is already deranged or destroyed. That's why you have frequency.
That's why you have frequency.
Number 1. Or maybe number 2, you have frequency because you have urinary tract infection.
Okay.
Yes.
Okay, so speaking of UTI, cranberry juice ba talaga, Doc? Does it actually help or marketing lang yan?
Fake news.
Because you just need fluids and liquids. It doesn't necessarily have to be
No,
cranberry
with
juice,
regards to
right?
cranberry juice, actually, cranberry juice was popular before during the early 2000s.
I like it in my vodka.
Yes, yeah, but they said it prevents urinary tract infection.
Buko juice.
No, wait. With regards
okay.
to cranberry juice, they said they avoid urinary tract infection. But during the late 2012, they have proven that cranberry juice doesn't prevent urinary tract infection.
It doesn't
What
prevent, it doesn't cure.
Yes.
But what about, you just mentioned
Buko
buko
juice.
juice.
They say,
regards to
buko juice mo yan.
Considering that it's fluid, it's okay. But actually, with regards to buko juice, it's more of just a diuretic.
So it's still basically liquids and fluids just to make you pee. So that's the basic principle, regardless of whatever it is, as long as it is, a chance for you to get to drink.
Actually, with regards to UTI, one of the natural remedies is you just drink lots of water. So that you could wash the.
One question
the
about
infection.
drinking, the amount of water that you drink and the amount of pee that you bring out.
Come out.
Is relatively equal. So is it true that if you drink a lot and then you pee a lot, that's not necessarily diabetes?
No. But with regards to diabetes, they really have frequency because
Even if they don't drink too much.
because their
Kasama
urinary
na.
bladder is already damaged. That's why.
Oh,
That's
Doc,
why.
from Roachman, urine is being mabula. Ano po yung cause?
With regards to urine, there are a lot of people are listening. When you notice that your urine has bubbles, they could be signs that your kidney is being damaged.
Oh my gosh.
Seriously.
Yes, number one, because the cause of the bubbles is number one, there could be sugar in the urine. So you should have a urinalysis. If there's sugar, you might have diabetes. Undiagnosed diabetes. Although the new medicines in diabetes right now let you urinate sugar. So it will really
Just to go out and released.
Yeah. It will cause your urine to bubble. And then number two, the bubbles actually is baby protein.
Yeah, I was gonna say
protein.
if you're a meat eater, you've had
No. But
steaks, not necessarily.
No, you should not have. You should not shed out urine on your urine. No, because if you shed out the protein in urine, your kidney is beginning to be damaged.
Oh.
And then
So
the
it's not-
manifestation is a bubbly urine.
Cass, hi Cass.
It's not necessarily just because you came from a samgyeopsal or an eat all you can steak thing that automatically have proteins in your urine.
Wait.
But the mere fact that you have bubbles in your urine, it needs further investigation.
okay.
Because it could be diabetes or your kidneys are being
But
damaged
definitely,
already.
damaged
slowly
already.
being damaged already.
So you have to
maybe.
Yeah.
But there are other factors like maybe the pressure in the bowl is just too strong or what. No.
The sign of that says, pero yung bubbles naman daw nawawala, Doc. Is that normal?
Sabi ko, baka naman,
The mere fact
baka
that
naman-
you have bubbles, it's really
It's not,
it's
it's
really
better-
necessary that we
Yeah,
investigate.
it's better to have it seen just to be sure. Unless na lang the urinal, they just cleaned it, so may detergent pa doon kaya bubbles.
May sabon na.
May joy. Frequently urination in the evening. Is it too bad? From Roachman again.
Yeah, with regards to frequent urination in the evening, that's what we call nocturia, no? There are a lot of factors. Maybe if you're a man, maybe your prostate is already large and it constricts your bladder outlet. Or number two, maybe you're drinking a lot of water or drinking coffee or alcohol at during nighttime. So number one, when you urinate frequently at night, which is called nocturia, 2 hours before bedtime, you should
No more
avoid
water.
any fluid, especially juices and coffee.
Okay.
And then you have to empty your bladder, urinate first before going to bed.
I got a good one.
Okay, go.
Doc, the temperature. I feel like when it's colder, I like when I travel sometimes and
Yes.
it's colder, I tend to like pee. Is that normal?
Yeah.
Okay.
That's one of
That-
the reactions of the
Yeah.
body.
And that one, I have an explanation as well because I literally had to ask my anatomy teacher for that.
Tell me.
But because muscles contract. One of the principles and objectives of muscles, not just for us to move, but for us to maintain our core body temperature.
Okay.
So we easily contract if it's cold. So because it was, as mentioned, was a balloon inside our pelvic cavity.
It
so
presses,
it presses on
Okay.
it. So that's why you actually have to pee when it's cold. But wait, my question was, how can you say that you already have nocturia? I mean, is there a count of how many throughout the evening, or is that every hour on the hour, every 2 hours, or every 30 minutes? So how do you qualify someone who has nocturia?
Yeah. It becomes abnormal, no? If you urinate at night more than 2 times.
More than 2 times. So
Yeah.
that's like if you sleep 8 hours, good if you sleep 8 hours.
Yeah.
So
So 2
a couple
times is still acceptable. If it's
so
more
if it's
than-
like 8, so like 4 times double done, nocturia na yun.
Yeah, it might be there might be a problem if there's nocturia.
Ang
Maybe you're
sosyal pakinggan eh. I have nocturia, guys. I'm puyat, guys. I have nocturia. Diba?
Yeah, at least we educate the listeners right now.
Yung pala yung tawag doon. I have nocturia.
In other words, ihi ka na ihi sa gabi.
We educated the what do you get? Gen Z.
Oh, ayan si designer that, may sabon-sabon pa pala.
Kasi naman, di ba baka bagong linis yung
Oh, yeah.
urinal?
Guys, ito na, seryoso to. A lot of men don't talk about prostate health until
Yes.
there's a problem. What are the early signs that we shouldn't ignore, Doc? And why do you have a walnut? Can I just see that, Doc?
Yeah,
And brought props.
It's not a walnut, okay?
It's a walnut.
Yes, it's a
But-
walnut.
Oh, it's
It's
I just
really a
opened it.
walnut. Yeah, it's okay. It's really
It is a walnut.
Okay.
it's a
Oh, is this for your
yeah, because the size of the prostate
Oh!
normally is
That's the
like
size of a walnut?
So that's not the
normal.
prostate, okay? It's just the size of the prostate.
Yeah, it's the
This
size.
is
So
a
that's a really
prostate.
walnut.
Yeah.
Oh
No,
my gosh.
that's a walnut, but the prostate,
the size.
the normal size is like that.
Okay.
It's 20
yeah.
grams.
Wow.
Yes.
Wow, 20
Fresh
grams.
pa ba ito, Doc?
Yes.
Fresh to?
No more.
Okay. Pagdating ko sa...
Actually, with regards to walnut, some people don't know what the walnut is.
Ito, walnut, guys, ayan.
No.
So this is the size of a prostate.
It's 20 grams, as was
The
mentioned.
normal size of the
Where's
prostate.
your props, Doc? Ay, saan ang ano dyan?
Yeah,
Prostate.
And then number one, kasi they have to know what the urinary tract system is.
Okay,
the
Doc,
one,
your camera is
It's here in front of you.
right here.
Okay.
Right there.
The urinary tract system is composed of the kidneys, no? It's the kidneys it's about the size of the palm, no? Slightly like that, no? It's located in the flank area, just below the ribs, left and right. So it is the one that filters the blood. So the blood goes in the kidneys and back to the heart.
Where's the
It's
damn
filtered.
liver, Doc?
Yeah, the liver's right
It's
in the right
way
side.
up higher in front.
And then the product of the product is the urine. So the urine goes here to the ureter, left and right. It's like a straw, smaller, thinner than the straw. And all the urine goes down here in the urinary bladder, just below the navel. It's like a balloon.
Okay.
Now the balloon expands while it is being filled up with urine.
With urine, okay.
Now with regards to the prostate is below the balloon. It's below like that. No. So this is the cross section.
Okay.
So the prostate is here. Now the size
Right
of the
smack underneath the balloon.
Yes,
I mean, the
just,
urinary
just
bladder.
underneath it surrounds the below the balloon. No, now the normal size is a walnut size.
Yeah.
It's like this. It's walnut size. For the other Filipinos, maybe they don't know that. Actually, the first time I saw walnut is in Dau, during the 80s. Because it's imported. It's not here in the Philippines.
It's not a local nut, okay?
And then it vanished in the Philippines. And then, but you could associate it with the siniguelas or
Yes,
lanzon.
siniguelas.
And
Siniguelas.
lanzones. That's
Yeah.
a normal size. Now, when we age, it gets bigger. When it gets bigger, the bladder neck, the below the balloon is being compressed like that. No,
Okay.
it's being compressed.
That's the prostate now.
Yeah,
that we're
this is the
talking about.
prostate.
Okay.
Okay. Now, when it gets bigger, gets compressed. It makes men be prone to urinary tract infection.
Okay.
Oh, okay.
So it's very important that the men will be aware of the signs of a big prostate.
Oh.
Is that something you remove, or like when you have one man get prostate cancer? Like,
No, it's a different thing.
That's a different thing.
What we're talking right now is a big prostate. Now,
Okay.
men they have their prostate get bigger as they age, starting
Ayun
at
nga.
the age of 40.
Ayan, Doc, sabi, sana hindi yung prostate getting bigger as we age. Decided, sorry to break it to ya. Buddy, I'm sorry. Hi, Doc, what is the avenue volume? What's the volume? What? Avenue
Average
volume.
size.
Average volume of urine. Again, we'll discuss later, but going back to what he's saying.
Yeah,
Okay.
yeah. So when the prostate becomes bigger, it doesn't necessarily cause problem if the urine, the bladder flow is not compressed. So you could only
so it's not an automatic thing just because you
It's
age.
big.
Your prostate becomes big or it becomes bigger, and then as long as that
the flow.
the flow is
In the middle.
still
The
not
tract.
hampered,
Yeah.
we're good.
Very good. Now you would know that it is
okay.
still good with regards to when what the patient is feeling. So the signs that it is being compressed is number one, if when you urinate you cannot urinate completely. Number two, you frequently urinate. In less than 2 hours, you urinate again.
Okay.
And then when you urinate, the flow in men, it dribbles like that. Like that.
So it could cause urinary tract infection.
No,
not necessarily.
They are signs that your prostate is big already. Or you can't control your urination.
Kasi ang laki ng
Or the
ego niya.
flow is being compressed during erection.
Doc, is ED or erectile dysfunction always a urology issue, or could it be
Yes.
something else?
Actually, with regards to ED, erectile dysfunction, there are two causes. Maybe it's number one, psychological, especially when you are on less than 40 years old.
Okay.
But but in elderly men, no, the causes of ED are they have several factors.
Pwede ba alcohol consumption?
No.
Wala ba?
Because with regards to erection, it's actually blood flow in the penile areas.
Okay.
Now, when the blood flow in the penile area is damaged, like if you have cholesterol or diabetes,
That still could affect
there
it.
you
it could
go.
affect
Or
your erection.
Even if you have heart medication,
There are some heart
That affects
medications that affects it, so we
Okay.
have to modify it. But the number one thing that we have to tell all the listeners here, if you have erectile dysfunction, you have to see a doctor because maybe you also have a heart problem.
Wait,
that's
wait.
why.
Because because in erection, it's because of blood flow in the penile area. Now
So it's still
maybe
blood.
it could be possible that there is also a problem in the blood flow in your
the
heart.
heart. That's why you have to have
you
exams.
really have to have a general checkup when you
my.
experience that.
We're talking about prostates and all of these things. There's one easy way to actually determine
If you have
if you have a normal prostate.
O kala ko if you have ED.
Not ED necessarily.
No, it doesn't matter actually if you have a big or small prostate, as long as you have good flow in urine. But with regards to prostate, it could actually lead to prostate cancer. So men, no, if you are 40 years old and have a relative who has prostate cancer or even breast cancer in women,
So
you
chances are...
there is a high chance that you have prostate cancer. So you have to be examined at the age of 40 in the form of blood exams like PSA, etc. But if you don't have history of cancer, you should have you should have prostate screening at the age of 50 or 55.
55. Okay.
The prostate, is that the...
Yeah,
That's the examination. It's called DRE, Padre.
DRE, digital rectal exam, because the prostate could be felt when you do a rectal exam.
There you go.
You on a glove finger. You on a
Yeah, it has to be a gloved finger.
glove finger. You with lubricated glove finger.
Okay,
There you go.
that's
Be specific.
The index finger on the rectal area, and you could feel the prostate there.
Okay.
The normal feel of the prostate is like when you clench your fist like that, and on the thinner area, it is firm.
Beneath the thumb, yes.
Firm. Now, if the feeling of the thinner area is soft and it's tender, it causes pain. The patient might have prostatitis.
Inflammation of the prostate.
Inflammation of the prostate,
Which
is which is most probably due to infection.
But that doesn't mean it's like prostate cancer.
No.
Okay.
It most probably it's just infection, and we have to treat the infection. But if you could feel like a nodule there, like when you could feel like a knuckles,
then,
the doctor will suspect that there could be cancer, and then it needs further workup like biopsy. Now there's more better technology with regards to detecting it. We could do an MRI, multiparametric MRI of the prostate, and then it tells you the higher probability that the patient could have prostate cancer.
Prostate
And then
cancer, yes.
we could biopsy, meaning you could target the 1 cm area more accurately,
Wow.
and detect it earlier. Because with regards to prostate cancer, we have to detect it early, at an early stage, even if the patient doesn't feel anything, because we could eradicate the cancer completely
As early as possible.
Yes,
Wow.
because if it spreads out of the prostate, you cannot remove the prostate. But don't despair. We could still control.
I was gonna ask you,
the cancer.
removable ba yung prostate?
Yeah, we could remove it surgically.
Okay. Well, when a prostate gets removed, will that affect like the where am I?
No, there are side effects with regards to operation of the prostate.
That's what you call
Like yung
prostatectomy,
sexual
right?
part, yung
Yeah,
sexual.
yeah. Sometimes-
are you guys bound to lose that? Yung desire?
Yeah, sometimes. With regards to prostatectomy, radical prostatectomy, in removing the prostate, there's a 30% chance that the patient could have an erectile dysfunction, or they can't control their urination. But then there are a lot of techniques right now that
Ang hirap maglagay ng diapers.
yeah. Actually, that's a problem after the surgery.
Yeah.
Now, although we have developed the techniques in surgery, like nerve sparing, because during surgery before, you damage the nerves. That's why you can't have erection or you can't control urination. But actually, when you detect the prostate cancer at an early stage, we could eradicate the cancer through radiation, or like brachytherapy. We just implant some small seeds, like the size of some rice, and then you just implant it on the prostate, and the cancer is eradicated, and
Wow.
it has a lesser chance that the patient could have erectile dysfunction or incontinence.
Wow, these are really advances in managing
And look at the
prostate cancer.
time.
I
It
know,
just
right?
flew by. Green scar, whenever I have a gout attack, I pee a lot. Is that connected, Doc?
Most probably not.
I was
Okay,
gonna
green
say,
scar, maybe it's all in
on
your
our
head,
end, I
but-
don't think so.
Cass, average volume of urine.
Yeah, the average volume of urine. Actually, urine your urine is produced at least 30 cc per hour. And
30
then
cc per hour.
30
Okay.
cc per hour. And then
I'm
the capacity of the urinary bladder, the balloon just below the navel, is about 500 cc.
Oh,
So,
that's a lot.
30 cc at 500. I mean, that's like a long time
Yes.
before it
yes,
gets filled up.
Yes.
Oh, okay.
Serious tanong, Doc.
Yes.
About ED. If you take sildenafil, is that
Yes.
the proper
Yes,
yeah, that's the generic
pronunciation?
of it.
As needed lang ba po siya, or para siyang maintenance?
It was with regards to sildenafil, you just take it as needed. You take it 1 to 2 hours prior to the sexual activity. Okay, but with regards to taking sildenafil, it should be prescribed by the doctor or urologist, because it's contraindicated in patients who drink nitrates. Nitrates are the ones that you take when you have some
Heart conditions,
problem,
right?
Heart problem.
So it really has to be prescribed.
But there's a medicine that you take every day, the tadalafil. It's a 5 milligram once a day, because Americans, they don't want to drink when it's there right away. They want to have erection all the way or during that every time. So they
okay.
developed taking the tadalafil, like the sildenafil, 5 milligrams every day.
Oh, wow.
And then the side effect is it also improves their urination. So
okay.
so we give it also in patients who have prostatic enlargement.
Oh, wow. Two-pronged.
Roachman again, semen with blood. What's the cause?
Yeah, with regard to semen with
Hoy,
blood.
pumunta ka na nga kay Doc.
Yeah. I
May
think
blood? Medyo alarming na yan.
Maybe some people also experience that, so it's okay. So with regards to blood in the semen, that's what we call hematospermia. The number one cause is because you have a long abstinence from ejaculation. So if you don't ejaculate or have sexual activity for
So
at
it's
least
bad
2
also for you.
or 3 months, sometimes you will notice that there will be blood in your semen.
So it's actually better to avoid prostatic cancer to actually.
No, that's not connected.
No, that's not connected. Okay,
No,
okay.
that's not connected. There's no evidence that frequent sexual activity or lesser sexual activity could lead to prostate cancer.
Okay. That's
But in
good to
regards
know.
with hematospermia, it's okay. But if it persists, you have to see
Consult
a urologist.
your doctor.
Yes.
So yeah, right. I think he has to go see you, Doc Ed.
Maybe he's asking for a friend. Who knows? Thank you to everyone on Playback for the wonderful questions. Doc, where can they find you? You have to come. Lahat na lang
There's
ng
always a part
bumisita
two.
dito.
There's always a part two.
May part 2. And you are more than welcome.
Yes.
Bring us some more walnuts that are fresh.
At least some of the people know what a walnut is.
Diba? Okay. Doc, where can they find you? And like, what is one thing you want to tell the listeners before you go?
Number one. We recently had Men's Health Awareness Month last June. Now, we urologists actually 70% of our patients are male patients. Now, it is very important to focus on men's health, no? And then the partners of men are their wives or their children, no? Now once they notice that their parents or their husbands don't seek consult to doctors, they have to convince. They're the ones to
They're the ones to convince.
convince that to see a urologist or have a general checkup, because it's very important to have a preventive medicine.
There you
so
go.
that so that you could detect any disease once it's still early, so that it could still be fixed during early stage.
Great. There you go.
And where can we find you, Doc Ed?
I'm just located here at De Los Santos Medical Center.
There you go.
Alagang Kalinga ba?
Doc Ed, we'd love to have you back.
Yeah,
Thank you so much
I enjoyed
for your time.
doing the show.
Saya
We're
na.
gonna have a part 2 of.
As
We're gonna have a part 2
all
of Doc
the
Ed.
way. They might think we're on drugs.
We're high on urine. I gotta pee, you guys. Okay, so yes, Doc Rylan, I'll see you. I won't see you next week.
We will. You'll still see me next
no,
week.
Sorry, not. But because you have a talk somewhere, yeah.
Oh yeah. Let's invite everyone to the Philippine Medical Expo. It's on August 13 to 15
Grabe.
at the SMX. There will be a collaboration with the Philippine Academy of Medical Specialists on the 14th and 15th. There will be a mini conference there. Well, we'll be giving a talk. So registration is free. Just Google the www.philmedexpo Philippines, and just register and get your QR code.
There you
It's
go.
free, so I'll see them there.
And I didn't have my lips done, okay? Medyo magalang siya, guys, because I had dental work 5 hours yesterday. I want to thank Doc Apostol and Miss Elaine, everyone at Apostol Dentistry. Look at my smile. So pretty. Yeah, one big reason for me to smile, diba?
Oh yeah,
It's
and
been
the
tough. It's been tough.
And the
but-
doctors in Agusan and down there, the Regional Assembly of the Philippine Medical Association will be in
Butuan. Wow.
on the 17th. So we'll also be there and see you guys there.
Thank you again, Doc.
Thank you. Oh,
Doc Ed.
Doc,
I enjoyed the show. I enjoyed
Come back.
doing the show.
You are
Yeah.
more than welcome. Ayan, iihi daw muna si designer.
Oh, nga.
Never hold
Follow
your
us in
urine,
the-
number one.
Yeah,
Never
there you
hold-
go. Never hold your urine.
Yeah.
Once
Follow us
you-
on social media, guys.
There you go.
Doc Rylan on Facebook for me.
And at the Tina Ryan on Instagram, Tina Ryan on Facebook. One more hour of music sweep, and then the boys will be with you. Bye, everyone.
Bye.
Magic 89.9.